If we don't take a global approach, we are missing the boat in a variety of ways.
This is an area of not just growth for the international sector, but it is also an area where we at UCSD are in the leadership role. This is a place where we want to be bringing more students to come in and train with us to really get out there and make solutions happen to improve health of women, of children, and of populations.
Biologically, culturally, socially, politically, we need full coverage of the planet. That's what we do in global health.
Global health has to do with all kinds of illnesses, all kinds of health problems, defined in many different ways all around the world.
Here on our campus, we are really fortunate because we have the first undergraduate specific major and minor in the UC system, and we just have a few of those even in this country.
I think UCSD is an amazing place to get those opportunities to learn in this field because we are not in a vacuum here with regard to our interdisciplinary approach. We are intersecting culture through anthropology, medical sciences through our premier medical school, engineering through our premier engineering school, and visual arts. These are all clear areas where we excel at the university and we are engaging from a global health perspective.
Also, if you look around at the kinds of research conferences that are going on around the world, there is increasingly an emphasis on global health. What this means is that we're getting more and more of a critical mass. What's exciting is that there is an increasing momentum that is going on a worldwide basis, and finally we're getting the attention that a lot of us have long been convinced is overdue.
I think global health is really exciting at this point in time because we are living in a circumstance where people have an increased recognition of our intersection with the global world. So the program is really, I think, a particularly interesting program in the interdisciplinary nature of it, as I've said before, because what it does is it's allowing you to make the linkages to a lot of different departments.
Global health and the way that we teach it and think about it on this campus is about understanding the social and political and economic determinants of health, which are actually overriding.
It is about population health, but when you think of population health, really considering what the roles are of culture, geography, political systems, stability, it is really tied into understanding what these broader social issues can look like for low resource settings. And that does often focus in the areas of low and middle income countries, but it can also be meaningful right here in the United States.
Yeah, so global health is a approach to health and healing that takes, first of all, the whole world population as its focus and as its target. And so it's a kind of public health intervention that I think is especially it's been wonderful. The best students I have are the global health students by far. You know, I know from teaching history of medicine that this is what the students who care about.
Global health is exciting right now because we're coming together and we're realizing that there is not this one approach to health problems.
Global health, I feel, is the perfect balance between health issues and social justice.
To me, global health is the ability to connect every part of science and art and humanities and history and geography to be able to understand medicine and to be able to understand the spread of diseases around the world.
If you are interested in health and if you are interested in having an impact on population health issues, you would benefit greatly by thinking of a global health perspective. If we truly want to have an impact on health, we have to think in terms of global health. The Ebola epidemic is a great example of that. We do not live in a vacuum.
The first thing that comes to my mind in that respect is our global health field experience. And some students go abroad, some students have their field experiences here domestically.
And this is really probably the best part of the program, I think, because once students get out of the classroom and into the field, into the real world, and see real people with real problems and illnesses and diseases and clinics, it really is transformative.
I was a part of the Health Frontiers in Tijuana HFIT free medical clinic, we come together and run this clinic on Saturdays that serves the vulnerable populations of Tijuana.
This summer I'm going to Cambodia with Alternative Breaks, and we're going to be caring for children with disabilities and teaching underprivileged youth.
I've had a couple experiences. Probably my most memorable one would be recently in South Africa when I went and studied anthropological research. We researched whether or not local villages were still impacted by apartheid.
We also have the new Chilean summer field school for our global health students that is very exciting. There's no shortage of possibilities, and it's growing pretty much as we speak.
If you're considering global health, you probably should do global health.
The students' energy and the quality of the students that we have here at UCSD and their passion, along with that which I and other faculty bring to the subject matter, has just been really electric.
So a lot of the students in there were global health minor students, and they were the most politically aware students I've ever had at UCSD by some orders of magnitude. These are the ones who understand something about how the world produces inequality, and the ones who care about that and want to make a difference in it.
If you have a passion for helping people, if you have a passion, a curiosity for research, if you have the desire that what you want to study and what you want to do eventually is something that's going to really matter and potentially make lives better and potentially save lives in the future, well, this is the program for you.
We do have several students who have gone on to public health programs, masters in public health, doctoral programs in social sciences, anthropology, economy, health policy, and then of course a huge group of health sciences, pre-med students that have gone on to medical school, as well as a health nursing school.
Of course, there's a lot of different things. It's incredibly versatile. There's working for non-governmental organizations, working for somewhere like the Centers for Disease Control, doing policy work, doing some kind of advocacy. You know, there's loads of things, doing all different kinds of research.
Global health is a good background for any option that you go into, whether you go into medicine or a PhD or epidemiology or law. Global health is an extremely strong foundation that you can use to really touch upon any interest of yours.
I plan on being, hopefully, an international diplomat. I really want to work with the United Nations or the World Health Organization to really promote health through policies. So I want to do policy work and also help certain countries reboot their healthcare system.
With the field of global health, I hope to use what I learn towards a medical degree. I hope to go to medical school and incorporate my anthropology background as a foundation to that.
I would love to be a researcher in global mental health. That journey begins this fall, where I'll be going to a Master in Public Health program at Columbia University. I'm very excited for that, and I'm excited what opportunities this program has brought me to make that a reality.
I don't see where global health couldn't intersect. Now maybe that's because I'm in global health. But I would say that the opportunities for the field are not just vast, they're vast and growing.
If for those students and faculty and researchers and clinicians who come to this field out of interest and out of passion, it can only grow and ramify, and it is work worth doing.
I've had students in this major, in the minor and then in the major, who have really pushed me to think about these issues in new ways. On a regular basis, they will say things to me or ask me questions or just present a whole attitude towards this that really blows my mind.
The University of California, San Diego, here we are the first UC school to have this program. We are one of the first schools in the nation to have this program for undergraduates, and we can really say that we're at the ground floor of the future of health.
I think that global health is going to go into an extremely important direction. My advice to any student going into global health would be just to try it, and because you'll love it.
If you're considering global health, I would say do it, because no matter what you're studying, there's absolutely a place for you in global health.
Look at our website. You can find all the information that's in this brochure, which is Global Health Program, all one word, .ucsd.edu.